Thank you so much.
You're welcome.
All right, so this is the first question. We've already read it. So what does that tell us out the gate? Because, you know, I look at what type of question it is because that tells me what type of answer I'm going to be looking for. So when we see first questions, what are we looking for?
So when we see first questions, we know that we're going to do one of the two, engagement or assessment.
Nope. I'm gonna take you up because I want y'all to remember. I'm gonna stretch it because I want you to remember when you see a first question. See, the first doesn't mean where you are in the process.
Oh, okay.
Understanding when you see first, remember we're looking for
the supporting. Okay.
Okay, the type of question does not really tell you where you are in the process. So now I want to know, since now we know we're looking for the most important thing, tell me where we are in the process. Does either of you see where we are in the process? Are we in the beginning, the middle, or the end phase of this helping process? If it tells
we're in the middle.
Yep, because after 2 months, that means we've been working with this client. So that means we are in the middle phase. So that tells me that we're active, okay? So now, what's the priority issue here? What is the priority presenting issue here?
Okay.
We have a social worker. She's at a clinic. She's seeing a client who's diagnosed with major depressive disorder. Psychiatrist at the clinic prescribed the client some Zoloft. The social worker observes that the symptoms hasn't changed.
That's the problem.
Okay. All right, because that's what's happening right here, right now. So remember, when we're looking for the problem, we're focusing on what's happening right here, right now. So people tend to pick out the presenting problem as the reason why the client is there. Please take it a step further for the ASWB exam, which is why we're doing priority issue now, because the fact that he's diagnosed with major depressive disorder, that's why she's seeing him. Yes, that was his presenting issue before. That's why he's there. But what's happening right now is after 2 months of working with him, she notices that his symptoms have not significantly changed, even though he's telling her that he's taking these medications. So what is the most important thing that you're going to do about this situation right here? Is it A, have the psychiatrist reevaluate and possibly change the medication? Pause or scratch?
Scratch.
Tell me why we're scratching.
Because it's already, the patient's already been diagnosed. That's not what the problem is. It's a medication problem.
Oh, I like it. I like it. All right. What about B? Is scheduling the client with the psychiatrist for a medication review going to be the most important thing we're going to do about this situation?
I say pause.
Okay. See the client twice a week instead of weekly.
Scratch.
Scratch.
Why are we scratching?
Because that's irrelevant to what we're talking about.
Pretty much. And what about D? Confirm that the client is not being dishonest about taking the medication as prescribed.
I mean, I say scratch.
Tell me why.
Because how can you really confirm that? Just it's their word. So
and it's like we're not even believing the client.
That perfect rationale. I will tell you, rationales are on point. Yes, confirm that the client is not being dishonest. That's how can you? You know, I mean, like, what are you going to, like, give them a lie detector test or whatever? So, yes, y'all be surprised how many people pick that answer, but good. That's why I want to know why y'all picked the answer and why y'all didn't, because it's good to know that. So, schedule the client with the psychiatrist for a medication review. Why is that the most important thing that we need to do in this situation?
Because maybe they're on the wrong dose. Maybe the medicine is the wrong medicine for them. And the
Absolutely.
Yeah.
Absolutely. Go ahead.
And I was just going to say, as social workers, we don't prescribe medication, so they need to meet with the psychiatrist.
And that's exactly where I was going next. Anytime y'all see something in regards to medication, normally on the exam, I'm not going to say always, but normally on the exam, the answer is always going to result in you referring them back to the doctor, because we do not prescribe their medication or do their medication updates and reviews and all of that. So usually when y'all see these type of questions, it's always going to kind of refer you back to sending them back to the physician to talk about whatever their issue is, to review it. And even in looking at the presenting problem. To directly address it, the issue here is that you haven't seen any significant changes. They're there for depression. You haven't seen the changes. The client telling you they're taking the medicine. So guess what? Let's do them. That seems to be the issue. The medication isn't working. So that's the only one that really kind of directly addresses is that. Let's just review it. Okay. So let's review that regimen. Any questions about that? I think y'all did like the teamwork was excellent. I really like how y'all rationalized those answer choices, especially the ones that weren't the answer. So good job at that. That tells me that y'all actually looking at the question the way y'all need to be looking at it. So good. Let's go to question 2. This is a different type of question. Again, a social worker is petitioning representatives in the legislature to provide more funding for childhood mental health screenings for children of at-risk families. This is an example of, and this is a community question, y'all. A lot of people struggle with these, so that's why I said I'm gonna try to start adding more community questions. So what do you think this is an example of? Is this case advocacy?
I'm gonna say no.
Okay. All right. Oh, let me scratch this out. Tell me why.
Because I was thinking of case advocacy is advocating for a situation, and this is more, well, petitioning. It just seems different.
Okay. What about political pressure? Are we applying political pressure by petitioning the representatives in the legislature?
I like that.
You say you like this?
Yes, I pause. Yes.
Okay. Excuse me. Is this an example of primary prevention when we go to petition representatives in the legislature?
No, I say
I like that one too.
Okay, so somebody like it, so we'll keep that one as well. Now, what about cause advocacy?
I don't even know what that is.
I'm saying keep it.
All right, so we got 3. And whenever it gets like this, when y'all really kind of just like don't know, and I'm glad I put this question here, when you don't know the answer, I tell people give your best common sense. So I heard you say that you didn't know what this was. Well, then just kind of like common sense it, try to. Like cause advocacy. What's a cause? You know what a cause is, that like, something you're standing up for. And then advocacy means something that you're also kind of like, you're fighting for a cause. Or that to me, when I see cause advocacy, I'm fighting for a particular cause. Okay. Case advocacy, I'm fighting for a particular case. So that's how I do when I don't know definitions to words. So most of the time it work out. So in doing that, so we still have 3. So let's go back and compare these 3 to what makes the most sense. So we scratched out case advocacy, which is fighting for a particular case. In this case, we're petitioning representatives because we want them to provide more funding for childhood mental health screenings for children of at-risk families. So that's pretty much, maybe the lower income families. So in petitioning representatives in the legislature, is that political pressure?
I don't think it's political pressure at all.
Okay. Because what is political pressure?
I feel like that's being aggressive. At least I don't feel as if petitioning is being
because
aggressive.
Petitioning, exactly said. Petitioning is not really aggressive. Adding pressure is, but when you're petitioning for something, that's not really being aggressive. To me, that's being more assertive. So we can eliminate that one. So now primary prevention, is this an example of primary prevention? We're trying to petition representatives. I gotta know.
I only say yes because of the mental health screenings. That's just keep sticking out.
Okay. And so what about cause advocacy? Are we fighting, because advocacy is fighting for something, a cause, fighting for a cause. That's how we're going to put that together. So it's petitioning representatives to provide more funding for childhood mental health screenings, fighting for a cause.
I like the, since you broke it down, I have a better understanding. And so it's like I want to put petitioning and calls together. They both sound good.
So what y'all thinking? CRD. What about you, Ms. Adrian? What are you thinking about?
I don't know. I think it's
Oh, I like when y'all get stuck. It makes you really think
know,
of the question for what it is. So that's a good thing.
I'm going to
So
say
y'all think
cause.
about
I'm going to
community.
say cause advocacy
Okay. And what you go?
because they're petitioning. It's a petitioning for a cause, which is providing
absolutely.
more funding. Right?
Whenever you're petitioning, you're advocating.
Okay.
Always think of that petitioning, you're advocating for any type of social justice, you're fighting for something. And the cause is you're trying to get more funding for mental health screenings for these, at-risk families. So definitely cause advocacy. And to be honest, this is a community question, but it's also a recall question. Just having to know, this is in the social justice section, just knowing what cause advocacy is. When you're simply put, just advocating for a specific cause. Okay. Right here it says refers to advocacy on behalf of people who lack the resources or abilities to advocate for themselves. Example, children of at-risk families. Okay. And this is the definition of the other ones. Political pressure refers to the use of political power to force change. So that means you're using political power to force change.
Okay.
So if you didn't know that one, I would make a note and just kind of go back and study the, social justice advocacy part of the content, just to be familiar with those type of terms. Okay, question 3. Anybody want to take this one, or I'll keep going for now? It's the next question.
I like how we do it. You read it and we kind of.
But here's the thing with me, I can't read it to you on the exam. So y'all, I'm gonna
I can.
how you test.
It'll be like you're reading. It never become a habit when I'm in the exam.
You gonna hear my voice? I'm telling you, y'all have to practice like y'all, or you have to practice like it's the real thing. So I want y'all to get used to reading in your own heads and not feeling guided. I feel like, I'm guiding y'all through the questions. I have no problem with that, but I think you learn better when, when you're, kind of taking yourself through it without.
I understand. Okay, I'll do it.
Okay.
A social worker is completing an intake for a client who is requesting medication to help manage chronic pain. The client's intake form reveals that the client is already taking narcotics prescribed by several physicians. What should the social worker do next?
Stop right there.
Yes.
So now you've read through it. So now tell me, is there a phase that we're in this helping process that you automatically know? Okay. Beginning, middle,
well, this is
end?
An intake, so this is engaging.
Yes, so that means we're in the beginning. You're completing the intake, so that tells me we are in the beginning. So what's the issue? What's the priority that we need to focus on here?
Well, it's not safety. It sounds to me like this person is drug seeking.
Okay, so specifically from the scenario, what are we highlighting as the priority?
The priority is the client is already taking narcotics prescribed by several physicians.
Yes, because that is what's happening right here. That's what makes this situation right here, right now, and it's a cause for concern. So now, this is the next question. So when we see next question, we're automatically thinking we're gonna do what comes next after the last thing the social worker did in regards to the priority issue. So in this case, the social worker has already completed an intake. So that means we have to do something that comes after we complete an intake, right?
Right.
That addresses this problem. So we're trying to find what we're going to do about after we did the intake. We noticed that this client has already taken some narcotics by several. So the next thing we're going to do is what? Is it A, you can kind of read through the answers.
Okay, so A is explain to the client why she cannot give him any more medication.
Pause or scratch.
That's a scratch in my opinion,
Okay, so tell me why we're scratching.
because we're not gonna, that's not making them want to talk to us if we right away become negative, a kind of accusing them of something.
Okay, what about you? Do you agree with that?
Yes.
Okay, so what, go ahead to B.
Request further medical information from the client, and I say I would keep that.
Okay,
Ask the client to sign a release to contact the prescribing physicians. I would keep that too.
okay,
And then D, send out a memo to all the pharmacies in the area about the client's multiple prescriptions. I've scratched that because that's just unnecessary.
yeah, doing too much.
Yeah.
All right, so we got B and C. So whenever we get down to the last two, to the best two answer choices, what you're gonna do is you're gonna take each one and go back and compare them against the presented problem and what the question is asking. So in this case, you're gonna say, okay, is requesting further medical information from the client going to be the next thing I do after I realize that this client is already taking some narcotics from several physicians? Or is it going to be me asking the client to sign a release to contact those prescribing physicians? What do I do next after this intake?
I might ask her to sign a release to contact the prescribing physician.
Okay. What do you say, Ms. Bridget?
I agree with C.
Okay, tell me why.
Because I don't need to request any more medical information from the client. That's like kind of being repetitive from the intake. Now I need to get a release to find out more information from the physicians as to why.
Because what is the issue? Because what is the issue about? The issue is that you're already taking a whole medicine by several physicians. So the only answer that addresses that almost has the words in it verbatim is C. And a lot of times that's how the answers are on the exam. If you just pay attention to what the priority issue is, most of the time the answer is going to match right up with it. So the issue here, these narcotics being prescribed by several physicians. Okay, so I need you to sign a release so I can contact them and we'll go from there. Since you requested, we'll go from there. I got to contact them first. Any questions about that? Okay, let me get the rationale. I thought I copied it. Okay. So it says coordinating care with physicians is critical to treatment planning and to proceed safely with a psych eval. Because you don't want to start, recommending him medication and he already getting doped up. Because that's gonna be, that's not gonna be too good for you.
Right.
Number 4. Anybody want to take number 4? Oh wait, this is a repeat. I skipped that one.
Okay, I'll do it.
Okay.
A social worker is referred. A school social worker is referred a 17-year-old male student who has a history of being delinquent, frequent school suspensions, and skipping school. The student reports that because of his negative behaviors, his parents have stated that he has to move out when he turns 18 in a few months and are trying to force him to join the military. In order to best assist the student, the social worker should.
Okay, so I think, hey, this is a should question. What that's telling y'all, which hat we putting on?
Are legal and ethical.
Yes, let's go ethics. Let's go ethics. And let me just clarify. Whenever it doesn't say should first or should next, if it just says the social worker should or what should the social worker do, 9.5 times out of 10, you going ethical. So that means we got to figure out what's the most ethical thing to do about this situation. Okay, so take me through this one. Is there a phase of the helping process that we need to pay attention to?
I would say the beginning because the school social workers just referred.
Just referred. Okay. All right. And so what is our priority issue here?
So I would say the priority to student reports that because of his negative behaviors, his parents have stated that he has to move out when he turns 18.
Right here, or just all of this?
In a few months, trying to force him to join the military, yes. In order to this.
Okay, all right. So this is my favorite line in the ASWB exam. When I see this one, I don't know why I get excited whenever it gives me this in addition, whenever it says in order to best assist the client, automatically my mind goes to meet them where they are. Okay, like, so wherever they are in their process, and that means mentally or, you know, emotionally, we need to meet them there. So in this situation, where are we meeting this client? Between a rock and a hard place. No, I'm being joking.
Like in the here and now, is that what you're talking about?
Yeah, like in the here and now, like we're meeting him basically in the point where it right here where it's saying, like, you know, he's kind of conflicted because he getting put out his parents' house and gonna force him to go to the military. So we're gonna meet him at that mindset. In the mindset of, man, I'm getting ready to turn 18 in a few months and life's about to get real. I gotta get out my parents' house or go to the military. So that's where he is. So that means he's probably of a conflicted mindset, right? So in order to best assist him, what is the most ethical thing to do? This is a 17-year-old with a history of being legal. So take me through the answer choice.
A, explore the student's feelings about preparation for independent living. I would say pause.
Okay.
I agree with that one.
What about next?
B, help the student figure out a way to convince his parents to let him stay after he turns 18. I would say scratch. We don't want.
Yeah, scratch.
Don't
you don't help. Oh, sorry.
No, you're fine.
Yeah, both of y'all go ahead. I want to hear all the perspectives. So why are we scratching?
We don't want to help the student convince his parents to do anything.
Wait, we don't. That's unethical to help someone convince them.
Yes. Okay. All right. So go ahead to C.
C, suggest family therapy to help the family work out their issues. We're not doing family therapy. We're only working with a 17-year-old male.
Okay. I agree. Scratch that.
All right.
And D, refer the student to a behavior modification program. I would say D as well. It does not match the presenting problem, and the behavior modification program kind of goes back in because of the history of being delinquent, minor, frequent school absences. It matches that.
Amen.
Right.
That's perfect rationale. And I'm glad about that because some people, when they answer this question, that's what they pick as a presenting problem, and that's how they end up with D. And to be honest, yes, D is the right answer for if we're focusing on the fact that this kid has a history of being delinquent as a minor. Here it is, though. It says it has a history of, so that's not present. So we're focusing on a present issue. So the only one that addresses the issue is exploring the student's feelings about preparation for independent living, because that's what this is about. Remember, I told y'all that we're gonna meet him where he is, and where he is in a conflicted state because he's turning 18 in a few months. His parents are saying he got to move out or go to the military. They trying to force him to join, so he's conflicted. So we got to meet him where he is. We got to explore his feelings about preparing for independent living, because one way or the other, when you got to go. Based off of what the problem is, one way or the other, you got to go. You got to go get out of there, or you got to go to the military, one of the two. So preparing him, discussing his feelings about getting prepared to live on his own is definitely, the priority of the most ethical thing to do. The rest of that stuff ain't ethical, like trying to help him figure out a way to convince his mom and them. That's not what we do. That's not ethical. So what are your thoughts about this question? I mean, I did really well with the question, but yes. I want to just make sure I ask y'all that, because I want to make sure that y'all are seeing it like y'all need to see it. Even if we get the answer right, understanding why we got the answer right, because I've noticed, especially over the past couple of weeks with you attending group, it's kind of like, it sounds like it's second nature for you now. Like you're now able to know exactly what we're looking for, exactly why we're looking for it, and you know what the rationale is behind it. So that's a major plus, that's major progress. So that's why I want to keep asking and making sure, how you feeling about it? Are you confident with getting to the answer? Did you feel confident getting to this answer when you worked this question out?
Yes, I agree. I do
Yes, I
feel a
agree.
little bit more confident now. And
Yes.
then, you know, before which was months ago, when I was
Mhm.
so hung up and trying to like, okay, I'm gonna do a lot of acronyms. Out, you know,
Yeah.
yeah. So I get it now, breaking down the question. It really helps.
Oh,
And you
yeah,
also see
acronyms
how
are
go ahead.
confusing. The acronyms are too
Yes,
confusing.
Lord. Yes, they
Yeah,
are.
my nerves can't handle those. See how quick, how much quicker you can get to the answer.
Yes.
Eliminate, nope, that ain't it. That's possible. Nope, nope, nope. Instead of just reading it all at one time and trying to figure all the answer choices out in the situation at one time, just process your way through it, and it actually saves you time. People probably don't look at it like that, but just processing your way through it, it saves you time to go through the question 3 or 4 times, or to go back and make sure you got the right answer, which is another reason why I'm trying to get y'all in the habit of knowing, okay, we're eliminating this, why? Because if you know why you're eliminated, chances are you're not going to want to go back and change your answer, because you've already, you know, agreed within yourself and your mind that that's not the answer, and you know why it's not. So when y'all hear me asking y'all why we're eliminating it, that's the primary reason for that, because it's going to stick. Okay? I'm not just speaking out it for nothing. So, all right. Question 6, a social worker at a substance abuse treatment center receives a referral from a client with a history of cocaine. During the intake interview, the client is resistant and refuses services, stating that he hasn't used cocaine in over 2 weeks. The social worker should first. Out the gate for me, I'm paying attention to the first question. That means I'm looking for the most important thing I got to do about whatever I identify. So in this case, where are we in the helping process?
Way beginning.
We're at the beginning because we just received a referral and we're in an intake interview. So that's let me know right now my answer has to be something that I will do in an intake interview. So any choice that I look at when I get down there, that's not something that happens in an intake interview, is getting scratched out the gate. The other thing we're going to pay attention to is that we are working in a substance abuse treatment center. Okay. A lot of times, if they specify a role, then that means it's going to be very relevant to the answer that you choose as well, because you're going to do something within that role. So now, what is the priority issue here?
Most important.
Yes. What is the issue though? What is the
priority? I'm sorry.
The
client is resistant and refuses services, stating he hasn't used cocaine in over 2 weeks.
All right. So now we're looking for the most important thing that we need to do about this client who don't even want service. Now we got this referral, and during the interview, he like, man, I don't want services because I haven't even used cocaine in over 2 weeks. What is the most important thing? Remember where you are in the process. What is the most important thing that we're going to do in this situation? Is it going to be A, explain to the client that doesn't mean that he is fully recovered from substance abuse?
I say scratch that.
Would
Right, that's too much talking.
Yeah, like that's kind of condescending too, like, you know.
Yeah.
Like, just because you've been clean for 2 weeks, that don't mean you fully recovered. Sit down somewhere. That's what it sounds like in my head. Oh, B, conduct a substance abuse assessment to obtain more information.
You don't need to do that. He's at a treatment center.
Okay, so we scratching it. We got to scratch on it too.
Scratch.
Yeah, scratch.
Acknowledge that the client has the right to refuse service. Is that going to be the most important thing we need to do?
Pause.
Yeah, pause. I agree.
What about D? Encourage the client to just give the treatment services a chance. Is that going to be the most important?
I mean, I really say
I
scratch
would
that
say
one. But
scratch.
yeah,
Why are we scratching it?
because we're not in a position to convince someone or try to push some to do something.
Okay, so looking at what the problem is, consider the situation, but focus on the problem. So consider the situation, we know that this man was referred because he has a history of cocaine use. But looking at the problem, he's resistant because he hadn't used it in over 2 weeks is what he says. So most importantly, we know that clients have the right to refuse services, period. That's always the first and most important thing. They have the right to self-determination. So encouraging the clients to just give the treatment services a chance is almost kind of disregarding his right to self-determination and the fact that he's resisting and refusing. So that's not the first thing we're going to try to do. If you refuse and you're going to start trying to bait them in to try the services, we don't want to do that. And B, I like what your answer was when you said we're already at the treatment facility or whatever the case. But beyond that, I want to point out, conduct a substance abuse assessment. People pick this answer because they're like, oh, well, we're in an intake interview. That's what we're supposed to do. But if this client is refusing, you're not going to keep on trying to do this assessment. That's not the most important thing. You got to meet him where he is and he's refusing. So the most important thing is we got to acknowledge that yes, I understand you have the right to refuse. First and most importantly, always. So I just want to point that out about B, not just because of where he was, but because of the fact that he's refusing. So it wouldn't even make sense to continue trying to do some type of assessment and he don't want services. We wasted our time and his time. Make sense?
Yes.
All right. So yes, just like the rationale says, most importantly, we got to respect the client's right to self-determination. So good job. All right. Anybody want to take number 7?
It's my turn. Oh,
Yes.
Go ahead. I'm loving it. Let's go.
a social worker works in an adolescent residential treatment program. The program prioritizes helping the teens adjust to a more structured environment and improving their self-esteem. The primary goal of the program is to help the teens.
All right. So now here we go again. This is another macro question, right?
Yeah.
So what's going on? Kind of these type of questions, when you notice these, most of the time they're not going to be like specifically broken down like the first and next questions, but you do need to figure out what's the main thing that's going on. So kind of let me know, what is the main thing that is going on in this situation?
The main thing is
the
goal of the program.
Yes. So we're looking to find the primary goal of this program, but what program?
The adolescent residential treatment program.
Yes, but here's what
the program. I see the program,
yes.
Helping teens to adjust them. Okay.
Yep, that's where the focus is. So when you're looking for something to focus on, it's usually going to be what the program is about. The program goal, in this case, is asking you the goal. So that means you got to go figure out what the program is about, and then I can kind of try to figure out a goal. That's how it works in the macro. Either you're gonna be figuring out what the goal is, or you're gonna take the goal to figure out the answer. So in this case, we have a program that is a residential treatment program, and it prioritizes helping the teens adjust to a more structured environment and improving their self-esteem. And there go my little arrow. Let me fix that. So think about that type of program. You're helping teens adjust to a structured environment and improve their self-esteem. What would be the primary goal of doing that? The primary goal of the program is to help teens. Is it A?
Experience positive parenting and role models. I say scratch that.
Why not? Why wouldn't that be the primary goal of this program?
Because that has nothing to, it's about teens, and it's not positive parenting and role models. It's about teens in there. Okay. Then develop new learning skills to help them succeed academically and socially. And I say we can keep that.
Okay.
Increase their respect for authority. I'd say scratch that. It doesn't. Like, okay. And then
wait, because why? Why are we scratching?
Because it's not these teens, the program is not talking about that they're disrespectful.
Okay, all right.
Then provide alternative support for their parents. I say scratch that because it has nothing to do with parents in the program. It's about teens.
So are you confident with saying that this is the
Yes.
that is the answer? And definitely your rationales was really good, really on point,
Okay.
because this has nothing to do with parents. So keep that energy or keep that mindset when you're answering these questions. Make sure that you are continuing to focus on what the problem is. That's why when you try to skip through, no, tell me what it is. This has nothing to do with them respecting authority. It doesn't say that they weren't respectful, whatever. It's just basically saying they're trying to get these teens to adjust to a more structured environment. That means these kids could have, maybe just came out of a chaotic home situation, to where they didn't have the best living conditions. And so, maybe mess with their self-esteem. So it has nothing to do with whether or not they respect authority. We don't want to assume that. Positive parenting and role models, that's not what this is about. And of course, D. So yes, helping them to develop new learning skills to help them succeed. That will definitely improve somebody's self-esteem. When you learn new skills, that's definitely going to build your self-confidence, which can lead to success in many other areas of life. So that is the goal of the program. And that's a macro question that I think you did very well on. So how do you feel about that?
I feel good.
Type of question. Okay, good. So just remember when you're answering these macro questions that you're paying attention to exactly what the priority is. And here, this is the priority. Every time you're answering questions, keep looking back at that red sentence. And the good thing is you get to highlight on the exam. So highlight the sentence, and every time you're looking at those answers, make sure you're matching it up with that sentence. All right, we got a next question.
Okay. A social worker is conducting an initial intake with a client who reports feeling sad, alone, and depressed after a recent breakup. What should the social worker do next? So
take me through it.
Okay, we're in the beginning phase because conducting initial assessment. So we're gonna, the presenting problem is the client reports feeling sad, alone, depressed after a recent breakup. And next, that means we're going, the last thing that was done by the social worker. Okay, A, assist the client with creating a safety plan. It does not mention anything in the vignette that the client is suicidal or homicidal. They're just feeling sad, alone, and depressed. So I would scratch A.
Okay.
B, help the client to identify any supports that she does have. I'm going to scratch B as well.
Why?
Help the client to identify any supports that she does have. I don't think we would do that next.
Okay.
C, conduct a mental status examination. I would say scratch as well. And because STEM, it didn't give us any clues to even do a mental status examination.
Okay.
Then D, acknowledge the client's expressed feelings. I would do B, acknowledge the client's expressed feelings.
Why? Why is that the next thing to do?
Well, we're in the beginning phase, so
and we're doing what? What are we doing in the beginning phase?
Engage with the client, and so, and feeling sad, alone, and depressed, to me, expresses feelings.
Yes. Yep. And so you're in this initial intake and you're gathering information but you're in the beginning phase of the process. So that means you're gathering information and you're also trying to start building a relationship with the client. So you're engaged with the client, trying to build rapport. So the client tells you how they feel. The next thing you need to do is acknowledge those feelings. And that's how you start engaging with the client and building rapport, even in the midst of gathering information in this initial intake, because it tells you that you're still conducting it. It ain't say you finished it. You're still in the middle of conducting it. And then the client tells you this. And so what you do next? So yes, you're going to acknowledge the feelings. So I put this one here like this because people get confused. This is one of the most common things that I found. People are getting confused with, oh, because this is the next question. You don't do this first. You do acknowledge the feelings first. That's what you do first. Or you assess the feelings first. So I intentionally made this a next question to show you that just because you see first doesn't always mean you're going to assess first. That's always going to be the answer, because that could be the answer for a next question as well. You have to take every scenario on a case-by-case basis, as you would do in real life, right?
Right.
That was the whole point of me kind of fixing that one up, changing that one up a little bit. Safety plan is not needed at this time. Exactly why you said there's nothing suicidal or homicidal. And doing an MSC, that pretty much means that the client is maybe kind of psychotic or something like that, and you're questioning the mental state. So that's not necessary. So good job with that one. How do you feel about?
I feel good about it.
Good. All right. We're gonna do this. You want to do this one? Or y'all want me to go? It's my turn. I'm gonna go. We kind of established a little rotation and didn't even know it.
That's
So,
right.
okay, so a school social worker receives a referral from a Caucasian teacher for an 8-year-old Black student. The teacher reports that the child is impulsive, combative, and is extremely disruptive during class. During the initial interview with the student and his parents, they appear to be agitated. The mother states, "I was warned about this teacher. She doesn't like Black people. What should the social worker do first?" Okay. So tell me, what phase of the process are we in here?
We're in the beginning.
Yes, the beginning.
Okay, so tell me why we're in the beginning.
Because the school social worker received a referral.
Right.
All right, so we received a referral.
Initial.
Yep, doing an initial interview. All right, so tell me, what is the priority?
First thing,
I would say the priority issue is.
I almost want to find out why the child, maybe try to figure out what the parent's understanding is as to what's going on.
I would say the priority issue is the mother states, "I was warned about this teacher. She doesn't like Black people."
Okay, and what would you say, Ms. Adrian? Like when we ask the priority issue, like I need to know specifically from the scenario, what are we picking? So we have this one is as an option.
Mm-hmm.
Do you think it's the priority issue, or do you see anything else that you feel like is a priority issue?
Well, the referral is because the teacher reports that the child is impulsive, combative, and extremely disruptive during class.
Mm-hmm. But the priority issue is what's the most critical thing that's happening in the here and now.
Well, then I agree. The mother is about what the mother says.
Okay, so the mother says, "I was warned about this teacher. She doesn't like Black people."
Mm-hmm.
Most important thing that the social worker should do about this statement, because that's the priority. That's what we're deeming a priority issue. So that means our focus, we consider the situation that this kid was referred, and we know why he was referred, but our focus is on the statement that the mom made. So that's where we look for our answer. Okay. So is the most important thing we're going to do about this statement is going to be recommend that the student be transferred to a class with an African-American teacher.
Scratch it.
Right, tell me why we're scratching.
That doesn't solve the problem.
Right.
Amen. Y'all getting this. Okay. So what about B? Suggest disciplinary measures to address the student's behavior.
I say scratch it also. That doesn't address what the mother said.
Yeah, because that's what we're focusing on. Keep focusing on the presenting problem. It won't lead you wrong. What about C? Clarify the parent's understanding of the reason for the referral. This probably should be.
I say keep that one. Pause, sorry. Pause.
Oh, sorry. Okay, wait, I'm getting my little stuff mixed up. Okay, so pausing that. What about D? Ask the family if they would like to involve the principal.
Scratch.
I say scratch that. It's not necessary.
Okay.
Right now. Right now, it's not necessary.
Okay. Let me scratch that. All right, so how confident are we with this answer?
I'm very comfortable.
100%.
All right, and you are 100% correct. All right, that's the rationale. So I just realized the other lady, she just sent me an email. She says she is having trouble. I gotta send her the link. So give me 1 second to send it to her. That's why she hadn't got in.
Okay.
Adrian, I think we're doing good.
Y'all doing
I like
great.
it. We're doing
Y'all
great.
doing great.
Yeah. Like I get so excited about this group every week. I'm like, this is about
So you do it every week.
honey,
Yes, she
if it
does.
makes, I would go without eating out 2 days for lunch. You spend this in a week.
Oh, I agree. And I think going out for lunch is a waste of money anyway, to be honest.
I can agree with that.
As I get closer, I'm probably I think I like that idea, do it every week, because I really enjoy the program.
And we have a smaller group, like you're more involved, and that's why I always share on social media. It's very interactive, a smaller size group. Even if we did have 10 people, it's still small.
Yeah, I agree.
And that's why I try to keep, that's my focus. I try to keep it on that, because I prefer the small groups, because I feel like you learn better when you can interact instead of just like, I don't learn like in webinars where I can't ask questions or participate. So I want to be able to focus on each person's individual needs, especially like when I get people that are coming in that are getting ready to test. To me, that's most important. Like, let me make sure I'm focusing on exactly what they may be having some last minute issues. You can't do that with like a whole entire group of people. So
that's true.
I really prefer the smaller group.
You prevent me from hiding, which I intend to do in a big group.
Yes, because I mean, what is hiding going to do? Like I feel like you have to kind of take this like you are when you go to the actual exam. And to me, that's the best way to do it, is just, kind of face your fears. You don't have to show your face or anything like that. But, I think it really to actually engage, because when you sit down to the exam, you're going to hear your own thoughts, your own voice, and you're going to be able to remember, oh yeah, I remember when I answered that question, I thought about it like this, or I processed it like this. It's way more helpful than me just sitting up here talking to you, and you're not going to remember half the stuff I said, to be honest, unless you're actually engaging. So yes. All right, so I sent the link. She should be getting in a second. All right, so we are going to go while I'm making sure she get in. Who's next? They can take this next.
I'll do it. I think it's my turn anyway.
Okay.
Okay, a social worker is looking to recommend a psychoeducational group for a 28-year-old man who struggles with socialization outside of his family dynamic. He has very few friends and has a history of switching jobs often and never stays on a job for long. He states that he prefers staying to himself. In order to best assist the client, what should the social worker consider when deciding on an appropriate group for the client?
This is a really good question. Okay, she's in.
Well, I mean, I feel like this is already an established. Maybe I'm looking, okay, forget what I said.
That's okay, just let's start with the process. Where are you in the phase of the helping process? Are you in the beginning, middle, or end of this process? Just look at it when you kind of feel like you're getting in over your head. Are you going too fast? Just break it down. What is this process? If it says any.
Well, it doesn't really,
Mm-mm.
you really can't tell if it's an established patient or if it's just.
But whenever you can't tell, whenever it's not identified, that also clarifies where a lot about your answer, because that tells me that it's not going to be necessary. I don't need to know that or consider that
Okay.
when I'm finding the answer. So don't get hung up on it. If it does not
Okay.
clearly state, then that means it's not relevant. So now you need to go on to determine what is my presenting priority issue now.
Okay, the presenting priority issue is, I guess, figuring out a group that best fits for this gentleman.
Okay. So what is that specifically in here? Like what line am I specifically highlighting as the issue?
We're recommending a psychoeducational group for a 28-year-old man who struggles with socialization outside of his family dynamic.
Okay, so this is what you're saying the priority issue is. Do you agree with her?
I think the priority issue is he states that he prefers staying to himself.
Okay, so we have a different. Miss Yolanda, are you in?
Yes, I'm here.
Okay, just want to make sure I sent you another email, so just check that when you get a chance. But I want to make sure you were in.
Yes.
Okay, so we have two different priority issues. You want to break the tie up?
I would say the same. Is the I guess my red sentence is that he states that he prefers to stay to himself.
All right, so let's figure this out.
Okay.
So if the priority is if the presenting priority issue is the most critical thing that's going on with the client right here, right now, that means we're focusing on what is the most important thing, what is the most critical thing that's going on right now. So a social worker is looking to recommend a psychoeducational group for a 28-year-old man who struggles with socialization outside of his family dynamic. That pretty much tells us what the situation is. Okay. It also, that's important. It also tells us he has very few friends and has a history of switching jobs and never stays on a job too long. Well, looking at this one already tells me this is not the presenting problem, because anytime it says it has a history of, that tells me that's past tense. So past tense can never be a presenting problem that's happening in the here and now. So he states that he prefers staying to himself. That is something that is current. And I will tell y'all another thing, whenever something is usually in quotations, that is in quotations for a reason, because they want you to pay attention to it. So this is actually going to be a big part of our priority issue. But y'all, I got this highlighted and I'm gonna tell y'all why at the end, because I don't want y'all to discount this, but this is more of the focus. But I really like that she pointed this out, and I'm gonna tell y'all why, because I don't want to give y'all the answer after the fact. But so continuing on with the question, in order to best assist the client, this is a best question. So y'all know whenever we have questions, where are we going?
We meeting the client where.
Yes, meet them where they are. So where is this client? Where is this client at in his emotions or in his mental state? Where are we meeting him at?
Where are we meeting him?
Being an introvert, we meet him right there. Prefer to be by himself. So we meet him where he is. That's where he's telling you, look, I ain't about that life. I don't like to hang out with people too much or whatever. I don't do that. So I like to stay to myself. So we got to meet him right there and be of that mindset with him. That's what, in order to best assist the client, we got to be able to understand where they are in their mindset. So that's where we're going right there. So what should the social worker consider when deciding on appropriate group for the client? That's what the question is asking. And that's why this part up here is still very relevant. Very relevant, because the question is asking, what should the social worker consider when deciding on an appropriate group for the client? However, I told y'all this is what the situation was. Problem is, you're looking for a group for a client who prefer to be to himself. That's the issue. That's why this is the presenting issue. So I just want to point that out. You're looking for a group that prefers, that has issues with socializing outside his family dynamic. He don't have friends. He switched jobs a lot, never stayed on a job for too long. So the issue is he just like really, like really dealing with people, and you're looking for a group to put him. That's why this is an issue. So in order to meet him where he is, what should you consider when deciding on an appropriate group for this client? Is it A, improving family relationships? Is that going to address the issue of him staying to himself?
Scratch.
I'll say scratch.
Why not? Why are we not keeping this?
Because he doesn't have he doesn't struggle with his family.
Exactly. That's the total opposite of what it says. So absolutely.
Right.
What about B?
I say scratch because we're talking about socialization. We're not talking about a career.
Okay. Yeah, agree with that, right?
Yes.
Okay, what about C? General adaptive functioning in social and work relationships.
I would say scratch.
Yeah, I would say scratch too.
All right, tell me why we're scratching. See, this is good. This is good. When you scratch stuff and you don't know why, this helps you to think and process why. Why, we're scratching it, but why?
General adaptive function and social.
Because when you tell me why, that tells me that you have fully processed it for what it is, for the answer that it is. When you can tell me why an answer is or is not, that tells me that you fully processed.
The reason that I scratched is because he's saying that the answer is saying general adaptive function. So he's saying that he wants to be alone. So what is adaptive and functioning has to do with like him being alone? That means like he's trying to adapt to like being with people, and he's not.
Okay, this is gonna get good. This is gonna get real good. I'm glad I left it like it was. All right. So what about D? Composition.
I say keep that.
With introvert personality.
Because that's his issue.
That, right. I think that's a perfect group for him.
Okay. So everybody's in agreement with this.
Yes.
So I'm gonna just be honest. Y'all don't be mad at me or whatever, but I kind of I let y'all kind of do your own thing and a little bit, because I wanted to just show y'all how important this is in this situation. When we consider the situation, we focus on the presenting problem. This is a very different question, but this is actually a question that you could possibly, or a type of question you could possibly see on the ASWB exam. So in here, all of this right here, y'all, and I wanted somebody to say, all of this right here is actually the presenting problem. This right here, he has very few friends and has a history of switching jobs. Now, I know I said he has a history of switching jobs. Is never is not the presenting problem, but again, we're going to focus. Follow me with this. We're going to focus here. This is our main, what makes this an issue, but we cannot have this without considering what the situation is. So that's why I kept saying we consider the situation, but we focus on the presenting problem. So all of this is the problem. This is what makes it the issue, right? So do y'all understand that? All
yes.
problem. So I just felt nobody really focused on this. So that's what I'm trying to stress. Don't just leave that out. Don't just kind of like say, like it's not there. It's kind of like it wasn't there. So all of this is a part of the problem. This is what makes it the issue. So this is the main focus. So when we're looking for a group, we have to consider the fact that, he has very few friends and he has a history of switching jobs, often never stays on a job for too long. The issue, because of that, because he prefers staying to himself, that's probably why he struggles with socializing and he switches jobs often. So let me show you the rationale. The rationale, the answer is actually C, general adaptive functioning, because that tells me he keeps switching jobs. He don't stay on a job long. That's the issue with adapting to social environment. Because he like to be by himself, so he might start a job and then get uncomfortable and quit.
That makes sense.
So that's why, y'all, this question is different, but this is literally an old ASWB question that's been retweaked. But yes, I didn't want y'all to just overlook this, because this also plays a part into why this is a problem. So yeah, this is the primary issue. He like to stay to himself, but this tells you a lot more, in addition. So
right.
the general adaptive functioning, I know I heard somebody say that, you know, like pretty much they were a little iffy about that. So considering the client's primary issues, his primary issues is that he struggles with socialization. He don't keep a job. He keeps switching job. That's his primary issue. That's considering the situation, but we're going to focus on the problem. The problem, he having these issues because he like to stay by himself, right? So trying to get him help. We're trying to get him in a group. So putting him in a group with some other introverts, how that's going to help them? They're going to all sit there and be looking at each other.
Right, you're right. That's true.
So that's not going to work. So you want to put him in a group, you want to have a group that focuses on general adaptive functions, showing them how to adapt in different social and work situations so that they can have those relationships, like work relationships, or just, you know, he's how old is he? Does it say 28? He don't socialize outside of his family. So we definitely get him into something, focus on some adaptive functioning. Do you understand?
Yeah, that makes sense.
Okay, now y'all not gonna see too many like that, but I found this question I actually really, really liked because I feel like it actually has a good point with making sure when I say up here, y'all, this is a good example of this right here. Consider the entire situation, but focus on the presenting problem, which is the most pressing thing in the here and now. So the most pressing thing again is that he likes to say to himself, but that's contributing to what his primary issues are. He can't keep a job. So in order to try to help him, we trying to consider on a group that's appropriate for him. You can't put him with no other introverts. You got to get a group that's going to try to resolve his issues. Okay.
I think the word maintenance got me on here because, like, when you think about adaptive, you think about somebody adapting to something.
Yes.
And so I guess that's what
he needs to be able to adapt in the social realm, like as far as you know, when somebody starts a new job, you have to adapt to that environment, to that work environment, to that social environment. But because he switches, he don't ever stay on job so long, that shows that, you know, he's having trouble adapting because he likes to be by himself. So he don't want to be a part of no work environment where he's forced to socialize and all of that. So just general adaptive skills is something that he really needs if he's going to be out in the real world. Adapting to the real world and adapting to the workplace, whatever it is, just being able to socialize within his family, that's not really he's not adapting to anything. He's never going to be able to keep a job if he can't adapt in the real world. So that's what general adaptive functioning is. What it says specifically in this rationale. A group that focuses on general life and social adaptation issues. Yes. So is it a little bit more clear for you on that one?
Yes.
Okay.
Yes.
All right, Ms. Shananda, take number 11. If you want to, if you don't mind.
Okay.
Do this
the social worker is.
Oh, hold on. This is we did this one. I must have did some repeats. I told you I was tired today, so please hold me accountable. I'm gonna get some more questions to replace those. That's a second repeat. All right, so just take this one. This is a different type of question, so I like this one.
Okay, it says, which other primary indicator of autism is young children? It says ambivalence, behavior, rituals, and obsessive ideas, a fixed idea that is not amendable to rational explanations associated with hyperactivity, a flight of ideas with rapid speech and expansive mood, and distractibility, and serious impairment in communication abilities and lack of ability to engage in reciprocal social relations.
So basically, the question is asking you what's the primary indicator when you are diagnosing someone with autism. And I put this on here. Autism is something that people have been telling me that they've been getting on the exam recently. And I believe it because autism is, of course, one of the things that's been highlighted a lot lately. So we gotta, know how to work with autism, knowing, what it looks like, how to diagnose it. So that's what this question is about. So out of all these symptoms that you read here, which one would be a primary indicator? And this is a assessment diagnosis question in so much, but I just want y'all to know exactly, what autism looks like or what the diagnosis criteria or whatever it is for, because you probably will see something about autism on your exam.
I'm truly between A and D. I
So
noticed,
let's look at A. So when we think about autism in young children, are they ambivalent? Do they have behavior rituals and obsessive ideas? Is that a primary indicator that a young child has?
Scratch.
Scratch, yeah.
Okay. What about B? Are those primary indicators a fixed idea that is not amenable to rational explanation associated with hyperactivity? And let me give y'all a synonym for this word. So we could say it's not agreeable. Let's say agree. It's not agreeable to rational explanation associated with hyperactivity.
I say scratch.
Okay. What about C? Think about a young child with autism.
Scratch.
Okay. What about D?
I said yes.
Oh,
Okay, so everybody's okay with picking D?
yes.
Yep, D is the answer. So at least y'all know what the symptoms are, what the signs are, should I say. So that's good. All right. Let me go ahead and post the rationale for that one. All right, 13. Anybody want to take this one?
I can do it.
All right.
A social worker is meeting with a 21-year-old college student who discloses that her music professor has made sexual advances at her during the last couple of rehearsals. She states that this behavior made her feel very uncomfortable, but asked the social worker not to disclose this information. What should the social worker do first? So I guess the first thing is to figure out the problem, I guess. Isn't that what I'm doing?
Are you you're figuring out what phase are you in, if it tells you in?
Well, it's the beginnings. It doesn't really say.
Okay.
Because she's meeting, and it's just based on what she's talking about. What should the social worker do first? Which is that the behavior made her feel uncomfortable. She doesn't want the term social worker to disclose this information.
So this is what you're saying a priority issue is, the primary problem?
Yeah.
Okay. And so now we are looking for what the question is asking of us. We already know is the first question. So that tells us we are looking for the most important thing to do about that problem you identified.
So validate the client's feelings and explore the impact of this experience on the client. I would pause that one.
Okay.
Report the professor. I would say scratch. It's not the first thing you would do. Explore in further detail the exact details of the incident. I don't think that's not. I would scratch that.
Okay. Why are we scratching that one?
Because right now we're focusing on her feelings, how she felt uncomfortable.
Okay.
Ask the client if she's afraid to speak out because of possible repercussions. I don't know if that's the first thing I would do. That might be the second thing I would do. I think that's why I think A is the answer. I would first validate her feelings.
All right. How y'all feeling about this one?
I agree. I would go with A.
I agree as well.
Okay. A is definitely the answer. Validating the client's feelings is the most important thing for the social worker to do, primarily because this is a 21-year-old college student. So we're not, in a rush to report the professor or dig deeper. She told you she's uncomfortable and you digging deeper and all of that. So the most important thing to do in these situations is definitely validate the client's feelings. Okay. This is probably, okay, this is more like a recall question. What is the primary reason treatment progress seems to occur rather quickly when working with a client in crisis. Maybe the client is desperate when they're in crisis. Pause or scratch.
I say scratch.
The client is in a state of equilibrium.
Scratch.
The client does not have identified expectations.
Scratch.
The client is more receptive to accepting help because of a greater state of vulnerability.
Keep. Pause. Keep.
All right. So yeah, that is definitely why treatment progress, like they progress faster when they're in crisis because they vulnerable and they open to any help they can get when they're in crisis. You get evicted from your house, give me any help you can give me, help that I probably wouldn't have accepted before. So yeah, that's definitely important to know about working with clients in crisis. All right, question 15. Anybody want to take this next question?
I'll take it.
Okay.
It says the social worker is meeting with a 17-year-old for the second session. After identifying the client's priority issues of wanting to be more independent, what should the social worker do next? So she's 17. It's kind of like, I guess it's a second session. So I don't want to say it's kind of like in the beginning, I guess, the middle.
Okay.
And she wants to.
Session means, you've already started working with the client per se, but I mean, you still could be in the phase of still, engaging or still trying to build rapport with the client as well. So.
So after identifying, I guess my red sentence is that after identifying the client's priority issues of wanting to be more independent, what should she do next? So it says obtain consent from the client's parents. Scratch. Assess.
Why are we scratching?
Because you should have did that in the beginning. I mean, the first session.
Okay.
It says assess the client's readiness for change. Pause. Explore the client's goals and objectives. Ooh. I'll say pause. Assist the client with applying for jobs and apartments. No. Scratch. So assist the client's readiness to change and explore the client's goals and objectives. Want to be more independent. I would say B, because I mean she's wanting to be more independent. So I would try to see like what's causing her to be wanting to be more independent now.
Does everybody agree or anybody has?
I agree with that. She already told us what her objectives are. Her goal is she wants to be more independent.
Okay. So looking at this one, we're working with a 17-year-old. This is the second session, right? So that does, like she has identified that does kind of tell me that, yes, we've already kind of went through a first session where we kind of, did some intake and stuff like that. So after identifying the client's priority issue of wanting to be more independent, what should the social worker do next? So when we're looking at the helping process, we know that we went through that first session where we kind of did the intake and gathered the information and all of that. So now we're in the second session. And so we've identified the client's presenting problem. And she's telling me, okay, my main issue here is based on the information you gathered from her in that first session, you now have identified that her main issue is wanting to be independent. So according to the helping process, after you identify the presenting problem or the goal of what the client wants to work on, what do you do next in the process? And that's going to be C. After you identify what it is the client wants to do, like what is the client's reasoning for being their priority issue? She wants to be more independent. So now in the helping process, next we go into the planning phase to where we're like, okay, so let's set some goals for independence. I want to have a house by the time I'm in 6 months, or I want to have a job first, and objectives. That's where you go next. Assessing the client's readiness for change. She told you she want to be more independent.
Oh, okay.
You ready?
Mm-hmm.
Ready for this. That's why she's there.
Mm-hmm.
So is it relevant? Does that kind of make sense?
Absolutely.
Okay. And again, this is still simple question, but it also is very important into why we got to make sure that when we're answering these clinical intervention questions, primarily first and next questions, we are going according to the helping process. So just remember, I identify the problem. What happens after I identify the problem? Because the priority issue is the problem. So after you identify, you gather information, you identify the problem, and after that, you start setting goals and objectives and a plan to address their priority issue. That's how work yourself through. So before we continue to the other questions, I just kind of want to pause and ask, is there any specific questions that you feel like that either of you feel like that, you know, okay, I'm really still struggling to understand these type of questions, whether it be first questions or next or anything specific that, you know, when you're studying that you're having trouble with processing, or you notice I keep getting these type of questions wrong or anything like that, that, you know, you kind of need clarification on. Any general questions about any of that? So everybody ready to pass 100%? Y'all all got it together?
But
That's what it sounds like. It sounds like y'all all got it together. Oh, you know what? Let me open this other file real quick, y'all.
I definitely would have gotten that one wrong on the test because I was,
Yeah, me too.
you know, sold on B.
Okay.
I think it's just continuing to study and be mindful and paying more attention to those questions.
Yes, and focusing on what the presenting problem is specifically and what the question is asking you to do about it, because that's the only thing. So I just want to make sure, because I know, like, you know, sometimes the next questions do trip people up because they're really focusing on what am I doing next. They're just focusing on the situation instead of what am I doing next after something specifically. So that's kind of why I asked that question before we actually continue on. Okay, so let's just continue on. I'm trying to pull up. Okay, here we go. Y'all can still see my screen, right?
Yeah.
Okay. Let's go. Anybody want to take this one?
I'll take it again.
Okay.
It said, a social worker is completing an intake with a couple who has been together for the past 7 years. The woman states that the man is lazy and does the bare minimum to help out. The man states that he is frustrated with their lack of intimacy. The social worker should, first, it says, so it's there in the beginning phase, it says they're in the intake and they're meeting with a couple.
Okay.
So she states he's lazy. And then the man states he's frustrated with their lack of intimacy. So they got 2 problems. So what should she do first? It says model effective communication skills. I don't know how you're going to do that. I asked how long each of them have been feeling this way and describe their.
So wait, did you say we're eliminating A? You say you don't know how we're going to do that. So does that mean we're eliminating?
Yeah, I want to scratch it.
Okay.
It says, ask them how long each of them have been feeling this way and to describe their concerns more in depth. I will pause. Suggest that the couple do something fun together, scratch. Discuss ways the couple can increase intimacy. I would say scratch. That's because that's only his issue. I would go with B because it addresses both of them.
And that's the key to this question. We're working with, please remember to not veer off on just one person issue. Working with a couple. Keep it together. Make sure whatever intervention you have addresses both individuals in the session. Okay. So right here, acknowledging each partner's feelings. So that definitely includes both of them. Any questions about that one?
No.
Okay. Oh, we got a good old recall question.
I can do this.
Okay.
Which of the following disorders carries the least risk for suicide? A, schizophrenia. I say scratch.
Okay.
Dementia, I say pause.
Okay.
Bipolar 1, scratch. Bipolar 2, scratch. I think it's B, dementia.
Why do you feel like it's dementia?
Because dementia is people with they have the long-term memory, they're losing their everyday, their short-term memory, they're not having depression issues, it's more of memory. So
Okay. What do y'all say? Y'all agree?
Yes.
Yep. That's exactly right. All the rest of these are more, psychiatric issues that does mess with the mind that could, kind of lead to suicide. So dementia, nothing like that. So definitely good rationale. You knew why the answer was the answer. So yeah, kudos to that one. All right, let's get this good old should question in. Nope, let me skip down. All right. Anybody want to take this should one?
I'll do
I
it.
can do it. Oh, okay, we can do it.
Okay. A client tells the social worker he is angry that his doctor keeps requesting that he get lab work done. He states, I think he must get paid more when he gets patients to do labs. I'm not going to get them done again. I just had them done a little while ago. The client has been diagnosed with bipolar disorder and is taking lithium to stabilize his moods. How should the social worker respond?
Now this one got a lot going on in it, so I want to see how you gonna work your way through the ones that be having a lot going on.
Okay. So didn't really say what phase we're in. So my presenting problem. Okay, so I would say my presenting problem is he is angry that his doctor keeps requesting that he get lab work done.
Okay. Anybody else agree or disagree?
What was your question? Is that what
What's
you
the
asked?
presenting problem?
Now, didn't you say the quotes are the most very important
I
in
did say
that question?
quotes, make sure
So-
you pay attention to them. That's what I said.
So, right, so the presenting, to me, in my opinion, it's where he's at right now. He's, so the problem is that he thinks his doctor, he doesn't want to get labs done again, that he thinks the doctor gets paid when he does the labs. Like everything he said in quotes, he must get paid more when the patient do labs. I'm not going to get them again.
Okay. So this is your highlight. Okay, cool. So we're gonna just keep up both of them up there like we did last time and see which one makes more sense as we go through. Or if they both make sense, we'll see. So, all right. So whoever had the question, what is the question asked?
How should the social worker respond? A, tell the client he has the right to refuse lab test. B, I'm sorry.
Also scratch.
Okay, I would say pause.
Okay. Anybody want to scratch that one? Anybody say scratch on that one?
I would say pause too.
Yeah, I would
Okay.
pause it too.
Okay.
B, explain the importance of lab work in cases of bipolar disorder, as the test can determine where the client is in the depression mania cycle. Scratch.
Why?
I agree.
The STEM didn't mention anything about bipolar.
Oh, okay.
And I would say scratch because I'm not a doctor to go in depth of trying to
Hey,
explain it.
hey, that
Exactly,
is,
that's what I
that's the,
said.
yeah,
Oh,
that's
yeah,
what
yeah,
I was
yeah.
waiting for.
Yeah, and it does say bipolar because taking
Yeah.
lithium. Okay, yes.
So yeah, but that's good. That's why I like when y'all feed off each other perspective. That's real good. Go ahead, keep going.
C, discuss how lithium can cause an increase in cholesterol. It's important to have cholesterol checks frequently. Kind of goes with the same thing Miss Yolanda just said about discussing
So are we keeping that or scratching it?
scratch.
Okay.
Explain how lab work is necessary to test lithium levels due to possible toxicity. I would say scratch as well.
Okay. Does everybody agree with scratching that one too?
Yes.
Now, I think you should pause that one.
All right. I like when we have a little conflict. Let's go. So let's talk about it. Tell me why we should keep A, and I want to hear from you, Ms. Adrian, why should we keep D? And I want it to be made in reference to what's going on in this situation. What's the priority issue? This is good. Y'all, we stuck with these two answers, y'all, because we stuck with those two priority problems. So we about to figure out which one is which. That's why this is so interesting for me. Y'all left with the two answers that match the two problems that y'all picked up. So I just want to hear y'all work it out.
I would say
Adrian, why are you defending D? Why are you keeping D?
The only reason why I think that is because I think when the patient is put on lithium, they're told that you have to get blood work done because lithium levels, to make sure the levels, it's a kind of like a thing that, I mean, I could be reading too into it,
Mhm.
but when he went on lithium, I don't know. I mean, I just think that it's dangerous for him not to get the lab work done.
Okay, I understand what you're saying. Now, what about why are we keeping A?
Well, the client can decide that he didn't want to have or can refuse to have the lab work done. That's why I chose A.
Okay, so this is a should question, and of course, we want to prioritize ethics, of course. So
isn't that self-determination as well?
yes, when we prioritize ethics, we're making sure we're doing the most ethical thing that is in the best interest of the client. So if we're focusing on a client tells a social worker he is angry that his doctor keeps requesting that he gets lab work. Yes, that is definitely an issue that's happening right now. He's angry about his doctor getting lab work. But then so just with him being angry, us telling him that he has the right to refuse the lab test, that could definitely be something. Like if a client is angry about, something, you could tell them, hey, you do have the right to refuse. But then the client goes further and he specifies, I think he must be getting paid more when he gets patients to do labs. I'm not going to get them done because I just had them done a little while ago. So this statement that they put in quotations, just like you said, Ms. Adrian, it does kind of stand the problem out. It makes the problem stand out. So that's why I told y'all when y'all see them, it's stressing something. Okay. So it's always important to pay attention to what the quotes are stressing. So yes, the client is angry that his doctor keeps requesting him, but now we got him stressing that, oh, I think he really not doing this to help me. He's just trying to get paid. So I'm not going to do this. Right. So that's what he's stressing. That's his reasoning for being angry about keeping going to get the test, because he feel like his doctor not doing it to help him. He's pocketing money. That's what's being stressed in these quotations. Right. So just like with A, if we just kind of focus on, he angry, yes, he does have the right to refuse it. But then when we focus on what he's stressing, it is our responsibility, our ethical responsibility to explain to him how the lab work is necessary to test his lithium levels, because he's taking it, and like you said, it is dangerous, and we know, so ethically we have to do what's in the best interest of the client, you know, and cause them the least amount of harm. We can't continue to keep giving him lithium if he won't let us test his levels, and we don't, you know, can't make sure we're not gonna kill the man, you know. So being that he's stressing the issue about that is because he thinks his doctor pocketing the money, making money off of it, or getting paid more money, that's where we focus it. And so it is our ethical duty to explain to him, no, it's not about the doctor getting paid, it's more about the safety of you. And so that's why D is the ethical answer.
Okay.
So I wanted y'all to kind of go back and forth about this one, because it's one thing to pay attention, because like I said, you wasn't wrong in this, but you always have to find that thing that kind of makes something more, a little bit more priority than the next. And so yes, him being angry, that is happening right here, right now. But when whatever he's stressing, let's pay attention to it. And quotation means we always trying to stress or highlight something. So let's pay close attention to what's being stressed and highlighted. That's the point of this. So you're trying to do the most ethical thing about the client thinking that the doctor getting paid from patients doing labs. So the most ethical thing that we need to do is explain to him that, hey, no, it's not about the doctor getting paid. It's about you, because guess what? If your level's too high, you could die. You're gonna go into toxicity or whatever, you know. So is that clear explanation? Does it make sense? Let me get y'all the people rationale, because it's not my question. I'm not claiming it, but it's a good question. You require frequent lab work to test their blood. We need to know that also, y'all, as social workers too. Blood levels for possible toxicity. Other medications, dehydration, and other medical issues can interfere with lithium levels. So frequent checks are important. Clients need to be educated on the importance of getting their lab work done on time. So yes, that is our ethical responsibility to keep this client safe, because that's a safety issue. Now that we look at it, huh?
Right.
So yes, so
Right.
so yeah, Miss Adrian, kudos to you for standing strong on your own, girl.
Thank you.
Yes, but I like it. I like that we're able to feed off the perspectives of each other, because like I said, y'all weren't wrong. Well, y'all were wrong, but you know, I had the right idea. I had the right idea of being wrong. You know, y'all get it. Okay. Anyway, just again stressing quotation marks, pay attention to them. I'm not telling y'all, of course, that they're always going to be the presenting problem, but they're going to be relevant. If not, they're going to be directly related.
No, I'm still.
Yeah, pay attention to them. That's all I'm gonna say. I don't like to be so absolutely like, oh yeah, because it's in quotes. It's always but I can tell y'all it's very close to being that. Okay, I just don't want y'all to be like Kim said. It's always in quotes. Nope. I'm not saying that. I'm saying always pay attention to what's in quotes, because it's gonna be very relevant. Okay. All right, let's go on to another one. And I know I got two other questions I have to go. I'm gonna go pull two other questions for those repeats to make sure we get all our questions done.
After this one, I'm gonna have to say goodbye. This is
Okay, no problem. And I'm gonna email you. Just let me tell you, since
Thank you so much.
You're gonna be emailed you're going to get the recording, of course, and you're going to get this document, so you're not going to miss anything. So even what we do after this, you're going to get all of that, the document, the recording, everything's going to be emailed to you. Okay, so no worries. So since you
will see me again soon.
I hope so, but let's go out with a bang. You this last one, get ready to go.
Okay, all right. A 50-year-old man is seeking services because he reports difficulty handling stress. He comes to one of his appointments stating he wishes he could just blow up everyone at his office, as he is angry with the way his supervisor is treating him. He states his supervisor ridiculed him publicly and his coworkers laughed. How should the social worker respond? Again, this is an ethical and legal obligation question, because it should.
Yes, ma'am.
Now it says seeking services, so I'm thinking this is a beginning. They haven't met before.
Okay.
And the problem is, that he's angry. Well, the problem really is that he just wants to blow everyone up at his office. That right? He doesn't like the way he's treated at work.
Okay.
So the A, ask the client to sign a contract stating he will not engage in any risky behaviors that could harm others. I say scratch that.
Okay. Anybody that we should keep it?
I say scratch.
Okay. All right, keep going.
As a part of duty to warn, call the client's employer to notify them of the client's threat. I'm going to say scratch that because he hasn't said that he's going to do something. He just said he would like to. He didn't say names or anything.
Okay. Anybody
Okay,
disagree?
sorry.
I want to keep it.
I'll say scratch because it says he wishes he could.
Right.
Okay.
Gain further information from the client about his possible intent or plan before deciding on a further course of action. I say keep that one.
Okay.
Yes.
Call the police and inform them of the client's threat. I say scratch, like you said, he wishes. There's no, I need more information.
Mm-hmm. So in any case with anything like this or anything with abuse or just anything like this, make sure you got you're as clear as you can be on the information. So definitely gather more information. And so this is where it got tricky a little bit because I kind of thought that you were going to pick what he states about his supervisor, which you didn't. We paid attention to what he said in quotations and the fact that he's stating that he wishes he could and not that he would. So that is definitely something to pay attention to. So yeah, C is the answer. Kudos, you're going out with a bang. Thank you so much.
Thank you so much. You're amazing.
See you soon, okay?
You are. You don't even realize it.
Oh, have a great evening. I appreciate it.
Thank you. All right. Appreciate
All
you.
right.
Thank you. Bye-bye.
Bye-bye. So does anybody have any questions about this one and understanding how the difference between he says he could and would and all of that?
No, that one makes sense.
Yeah. Okay. All right. So let's get number 20. Anybody want to take number 20?
I'll take it.
Okay.
As a school social worker receives a referral for
I could barely hear you. I don't know if it sounds like you're going in and out.
Oh, okay. It says a school social worker receives a referral for a 5th grade student who has trouble staying awake in class and has been observed on several occasions taking several classmate lunches and sneaking food in her backpack. The student also struggles academically. Upon meeting the student, he informs you that his mother is currently incarcerated and he and his siblings are being raised by his 80-year-old grandmother. What should the social worker do first?
Oh, this is a good one.
Well, my presenting problem is that he's stealing food.
Okay.
And so
Do you agree?
Yeah, I do. And that he's struggling academically.
So we got this, and the students also struggling academically. Okay. We didn't mention where we are in the process. That might be important to
I
not
would
be.
say in the beginning.
All right. So we got a referral. We got a 5th grader. So pay attention to the age. I didn't want to do that. All right. So what's next? So we got the presenting problem. What is the question asking?
What should we do first? But I also think that there's concern that his mother is incarcerated and they've been raised by, the 80-year-old grandmother.
Okay. So it's a lot going on here. So it's a lot to kind of try to figure out, what's most important to focus on, because it is this question all over the place. It's a lot going on. So we're looking for what though? This is the first question.
So it says, arrange a meeting with the grandmother, student, and teacher to discuss possible resources and solutions for the student and his family.
Is that going to address your Presenting it.
Mm-mm.
Okay.
It's to speak with the teacher about specific academic
Special,
accommodations
yeah.
for the students. No.
Mm-mm.
Report the situation to CPS. Pause. Ask if there is anyone else available to help care for the children. Scratch. So it's C.
Okay, so tell me why is it C, and do you agree, Ms. Bridget?
Tell you why I think it's C.
No,
Well,
do you agree with her first?
oh, yes, ma'am.
Okay, so I want to hear her rationale first. Then tell me why you think it's C.
I would say now that I'm looking at it, I want to change it to A, because there's just so many issues going on.
Okay, so wait, I want to hear. Okay, so she want to change her answer. So what about you? Do you want to change your answer, or tell me why C is the answer?
Now I do like A, but I was just thinking trouble staying awake, sneaking food, struggling academically. Yeah, I really like A as well. Oh,
Does
man.
A directly address the issues here? Doesn't really line up.
And so with the school social worker, they do a lot of
I'm glad you paid attention to that.
reporting to CPS.
They do?
Yes.
Okay. I didn't know. I never worked in school. Okay. So where we going with the answer? Which answer makes sense?
I don't know. I'm gonna go with C.
All right, y'all. When you can't make it make sense, because y'all been on the roll, all right? And y'all been on the roll and y'all been getting to these answers like literally without the confusion. So let me tell you, let me just let you in on a little secret. Whenever y'all get stuck like this and you can't make it make sense, 9.5 times out of 10 is because you're focusing on the wrong problem. And the issue here, because it tells you that you receive a referral for a student who has trouble staying awake in class, has been observed on several occasions taking classmates and sneaking food into his backpack. He's also struggling academically. Yes, this is all what's going on with the class. However, upon meeting with the student, this is when things get happen in my presence, in my hearing now. Considering the situation, this is why I keep stressing you do take this into consideration, because that's what's happening in his situation right now. But in my hearing now, in my life, I'm meeting with him. So what's happening when I meet? All this did already happen. It's already going on. So when I'm meeting with him, this is what he tells me. This is what happens in my hearing now. So this is what I need to focus on. So when this child tells me, look, my mama in jail, my grandmother is trying to raise her, she 80 years old, whatever. The most important thing I need to do is not report the situation to CPS, because there's nothing to say any suspected abuse on these kids, or, you know what I'm saying? Like they're just being severely neglected. So before we do that in any situation, of course, we want to gather more information. Before you try to report anything CPS, y'all remember, I've been stressing this every session today. Gather more information first. And you do that by arranging a meet with the grandmother.
Okay.
The student and the teachers discuss possible resources and solutions. So let's see what's going on. Woman, she's 80 years old. Maybe she's not able to cook every day. So maybe we can send lunches home with them. That doesn't mean that they have to call CPS because she can't take care of them. She's able to keep a roof over their head. She's making sure they bathe or whatever. Make sure they're not saying that they're dirty or, it's dirty. Maybe there are some other resources that, can be discussed or implemented before we just, put CPS in their life or whatever. That's one thing I've been really, really stressing today, is that we as social workers, y'all, they got a stigma against us anyway. All we do is take people kids. That's all I hear. I've never worked for DCFS in my life, but every time I say I'm a social worker, somebody assumes I'm taking somebody's kids. And that's why, and we even have the mindset of we report everything. Like every time somebody's studying, oh, you report. No, you gather information. Like, don't be trying to snitch on nobody and you don't even know what the real situation is. Let's see what's going on so that when you make the report, you have good, logical, informed, factual information to report instead of just, he just stealing food. He could be stealing food because he greedy like my children. My children, they like, I'm serious. I got a 5-year-old. Man, we go places, they act like they don't eat. I'm just gonna say this. So, and especially if it's a boy, so you just never know. And if he be staying up, the grandma 80, she probably be sleep early. So he might be staying up watching TV all night. So just trying to report them to CPS for stuff like that. You just never know.
Right.
Because if he ain't sleeping, he probably struggling. Or she 80, she can't help him with his homework. So let's just, arrange a meeting. Makes sense?
It does.
That's the most important thing. So basically, let me say all of this before we continue. Kind of just be live, like literally live yourself into these situations. Like I literally can't even really explain that I put myself in these situations. I literally see myself in these situations, and it really makes more sense to me. Like I imagine myself just sitting there in a 5th grade student, and then me in my mind, I take it a whole lot, a little bit farther, and a 5th grader. I think of what 5th grade student that I know, a niece, a nephew, a cousin, or something like that. And I imagine this kid coming up to me, or I see them staying in, having trouble staying away. What would I really do? Would I just automatically, I talk to him like, oh, I'm being raised by my grandmother. No, I'm not gonna get on the phone with CPS. I'm going to try to want to work with the family and see what I can do to help. I don't want to disrupt the family. And I think the average person, social worker, will have that mindset too, but we just kind of thinking so booky because because of this exam. But really and truly, if you really put yourself live in the situation, I promise you, it really helps to make most of this stuff make sense, because this is natural stuff you would do in real life. I really just don't think that you would just jump on the phone with CPS without even talking to the grandmother.
Right. That makes sense.
So anyway, yeah, that's my spiel. Go live. So all right, so any other questions, especially for you, Ms. Bridget, because I know we're actually at the end for you, but I'm gonna put another question up here. Ms. Yolanda, I owe you some time. So do you have any questions so far before we get into another couple of questions, Ms. Bridget, just moving forward?
No, ma'am.
All right, so I'm about to give you another, I'm trying to copy the other one over. Where is it? Okay, this is it. All right. All right, can y'all see that okay?
Yes.
All right, anybody want to try to take this one?
I'll do it. A social worker at an adoption agency is meeting with a lesbian couple who is interested in pursuing adoption. They state that they have had difficulties finding resources and support because they are a same-sex couple. The couple says they are ready to start the adoption process, but don't know where to begin. What should the social worker do first? So I would say we're in the beginning phase of process.
Okay, why is that?
A social worker and an adoption agency is meeting with.
Okay, yep. Mm-hmm. As long as you're identified, yep.
Okay. Oh man. I would say the presenting problem would be they state that they've had difficulties finding resources and support because they are a same-sex couple. Or wait a minute, hold on, let's see, hold on.
Okay.
Is it ready to start? That could be a problem too.
Yeah, the weirdest thing just happened. I think my dog noticed was the time I was supposed to quit because he literally walking up to the door and he whining. It's time.
They're like children.
They are like real people. It's so crazy. He's gonna sit there and wait for me too. But anyway, go ahead.
I don't know if I want to make that my presenting problem.
Okay, why not and what is?
If state they had difficulties finding resources and because I like the second, I like the couple says that they are ready to start the adoption process, but don't know where to start.
What do you think, Ms. Yolanda? I'm curious before I let y'all in on a little secret.
Where we should start?
No, what's the presenting issue?
I think that the couple says they don't know where to start. They want to adopt, but they don't know where to start.
Okay, so we're in between this sentence and this sentence. So I probably said this before, but let me remind you. This sentence says they state that they have had difficulties finding resources and support because they are same-sex couples. So have had already to me denotes past.
Okay.
So that's not the present. So the couple says is what's in the present. They're ready to start the adoption process, but don't know where to begin. This is more present tense. So that's if you're trying to, go between the presenting problems, do not go with the one that has the past tense in it.
Okay.
All right, so continue with this first question.
A, refer the couple to a support group for same-sex couples who want to adopt. I would say scratch.
Why?
That does not address start the adoption process, but don't know where to start.
Okay.
B, X declines if they feel discriminated against. Just because they're having difficulties finding resources doesn't necessarily mean.
That ain't the present problem. So
that's okay. I'm sorry.
Yeah.
That doesn't have anything to do with not knowing where to start.
There we go. That's what, because we focus on what's in red.
Okay, correct. Explore foster care as an option. They didn't say they wanted to adopt any children. I mean, foster any children does not have anything to do, so scratch.
Okay.
And I would go with D, acknowledge the couple's concerns and discuss the adoption process.
And you would be absolutely right. Because think about if we would have went with this one, they state that they have had difficulties finding resources and support because they are a same-sex couple. The most important thing to address that would be to ask them if they feel discriminated against, because that would be the most important thing we need to focus on if we're focusing on that. On this as presenting issue. But the fact that we're focusing on what's happening right now is, look, we're ready to start the process. We just don't know where to begin. That is their primary issue. So let's acknowledge their concerns and discuss the process. That's going to help them work it out. Again, adoption process. You see how they match up?
Yes.
That's just it be like that. It really be like that on the exam. So that should be very helpful now that you have that perspective to see that. So yes, acknowledge the couple's concerns and discuss the adoption process. Yeah, we got all of that. All right, so that's going to end our session as a group.
Okay.
Any questions, Miss Bridget, about any of this so far? I think honestly, like you are, every week it's just like, I feel the growth. I can hear it. So like, how are you feeling in lieu of, your progress every week? Because I mean, it's significant.
I feel really good about it.
Okay.
I do.
Good.
Mm-hmm.
All right. So are there any areas